Happy Nurses Week. It is my honor to celebrate Nurses Week this year with each of you. The last 2 years have been challenging, and we have faced unprecedented staffing challenges, burnout, and witnessed incredible human suffering. Our nursing teams have risen to the challenge and have demonstrated strength and resiliency and compassion while caring for all of our communities during the course of the pandemic. We have continued to improve nursing outcomes despite the many challenges that we have faced. We have continued on our magnet journey in hopes of a designation early in 2023. We have continued to move forward with advancing our nursing practice through advanced degrees and certifications, and our frontline team members achieving clinical ladder status. All of these achievements highlight the excellence in nursing demonstrated here at Chesapeake every day. I would like to thank all of you for your dedication, care, and commitment to our patients, to our community, and to our organization. You have worked through physical and mental exhaustion, and for that we are forever grateful. Our community is healthier and safer for the care that you have provided for the last 2 years. It has been a privilege to serve as your nursing leader during the course of the pandemic and witness all of you at your very best, rooted in strength, dignity, and resiliency. Thank you for all that you do and all that you are that makes Chesapeake a great place.
Well, hello everybody. The hospital asked me to come by and just say a few words to the nurses at the hospital. I'm very glad to do so. For those of you that don't know, I'm Dr. Smits. I'm one of the physician anesthesiologists. My home is basically in the OR area, so SAU, OR, PACU. Those are the nurses that are like my family that I literally couldn't do anything without. Those nurses there certainly know that we're having some transitions with anesthesia, and so what each of you is doing now is more important than ever. But I do get around the hospital and see others of you around. But again, a sincere thank you for all you do. But beyond that, when I think about the hospital, I think about the people I work with. And that isn't just the doctors, it's the nurses. And I think about one nurse from the recovery room who's leaving after 20 years. And I think about one nurse in SAU, and we talk about her children in the orchestra in high school. And so it's not just the work you do, it's also the relationships we have that I value incredibly. So we all spend a lot of time at work, and it's very rewarding to be able to share our lives together. It's a hard job, it's a good job. It's stressful and it's rewarding, and having the personal relationships that I have with many of you just makes it all the more valuable. So a hearty congratulations to those of you at the Nurse Exemplar and to all the nurses in the hospital. Thank you for all that you do.
Hello and congratulations. Happy Nurses Week. My name is Ray McHugh, and I am one very proud Chief Medical Officer to have had the opportunity to serve alongside you for almost 5 years now. During that time, I've been consistently impressed with not just the quality, but the care, the concern, what you bring to the bedside every day, what you bring to the families, your collegiality, your ability to work in teams. This was in extraordinary display during the last 2 years during the pandemic. You were asked to do so much with so little, consistently, day in, day out. On more than one occasion, I had the opportunity to sit with you in difficult family discussions dealing with end-of-life issues and continuation of care. What always impressed me was how you could be in the moment and caring for that family, yet be able to show extraordinary resilience and the ability to go back to the ICU, back to the floors, and deal with the next family in stress, and somehow find it within you to still offer that same level of compassion, quality, and care. It has just been extraordinary. For me, it's been humbling, and I'm just so proud to support you in all you do here at Chesapeake. Thank you.
I'm Ann Hutchinson. I'm one of the hospitalists with Bayview Physician Services, and on behalf of our team, I'd like to wish a warm thank you to all of our wonderful nurses. I have a unique opportunity to work with nurses across all of the units, from the ER to the ICU to step down and all of our floors. And there is no level of thanks that we can express to encompass all of your hard work over the last few years. Particularly those of you who have stayed with us in the last 2 years and persevered, we can't thank you enough. And for those of you who have left families and time at home with loved ones to join us in our time of need, we thank you.
My name is Derwin Gray. I'm an obstetrician and gynecologist. I primarily work here on labor and delivery and in the main operating room. And in my 6 years of being a physician, I definitely would say that the nursing staff at Chesapeake Regional has been the most professional and reliable and hardworking that I've ever encountered. Labor and delivery requires a really important trust between the entire staff when it comes to taking care of those patients, and the nurses at Chesapeake Regional, definitely on labor and delivery, make it much, much easier for me to sleep at night and for me to feel comfortable taking care of patients.
To our nursing staff at Chesapeake Regional Healthcare, from the bottom of my heart, I'd like to thank you for all that you do. You are the heartbeat of our organization. From your daily service and the comfort and care that you provide to our patients and to your peers with whom you work, thank you. We are grateful for all that you do, for the early mornings and the late nights and the stresses that you take on, the burdens that you take on. You care for other people's burdens daily, and we are grateful. You inspire others. My daughter has decided to go into medicine, partially because of the volunteering that she's done at our hospital and the nurses that she's worked with. And for that, I thank you. You're inspiring the next generation as well. So as the authority chair, as a previous patient of our hospital, as a community member, again, sincere gratitude for all that you do. Thank you.
I'm so happy to celebrate Nurses Week, and I'm very proud of the Chesapeake Regional nurses that support the communities we serve through thick and thin. In recent weeks alone, I've acknowledged a nurse at a board meeting for the compliment she received from a visitor. I've attended 2 Beacon Awards, each featuring a nurse, for their critical thinking and extraordinary teaching abilities. Interactions that impact others' lives forever. And these acknowledgments happen frequently. Nurses exemplify all of our values: safety, service, dignity, integrity, and innovation. We are a 4-star hospital because of you. We could never be a 5-star hospital without you. After all, you all are our stars. It's an honor and a joy to express our gratitude for your commitment, your skills, and your passion. Happy Nurses Week.